Women are getting a simple blood test to gauge fertility health. It's no secret many women are choosing to start their families later in life, yet how easy or difficult it is to get pregnant is often a mystery until they start trying. Dr. Lisa Hansard of Texas Fertility Center is here to talk with us about that. Thanks for being here this morning.
Thanks for having me.
Absolutely, an important topic for so many people trying to start a family out there.
It absolutely is, and like we discussed, until you actually start trying, you don't know if it's going to be difficult or not.
And where does this test come in, and what's it called?
Well, it's called an ovarian assessment report, or an ovarian assessment test. An ovarian reserve refers to quantity and or quality of the eggs that a woman has. And this is a fairly simple way to look at just hormones that the ovaries and the brain secretes that can give us an idea of what the potential is for a future pregnancy.
And I'm sure that can help as a good roadmap as your fertility path moves forward for couples.
You know, so many women, for either personal or professional reasons, are choosing to delay childbearing, and this is a way to look at least one factor that can control your decision making on when you want to start trying to get pregnant.
And you said one factor. There are a lot of factors. What are some of the key ones that affect fertility?
Clearly the most important one is age, but there are other lifestyle choices, most significantly cigarette smoking, that can really impair ovarian function and egg quality. The other thing is a strong family history of early menopause in the females.
Why are you seeing more women sign up to take this test?
It's such an easy way now to be able to say, if I'm going to choose to delay getting pregnant, is that the right decision, or do I need to talk to somebody about what options I have to make my chance of pregnancy in the future successful?
And who would benefit most from taking this test?
Well, for sure, all women who are struggling with getting pregnant right now, and those women who want to do what they can to ensure that by deciding to wait, they're not dramatically impairing their opportunity to have a successful pregnancy in the future.
And what's that age range?
Probably, I hate to say this because it makes everyone really nervous, but you really should start thinking about it in your 30s, particularly mid-30s or beyond if you're going to wait.
Yeah, and you all are offering free ovarian reserve tests through August. How can people take advantage of that?
Through the end of the month, we are offering free ovarian testing. The easiest way to get that information is to register for it on our website at txfertility.com, ovarian reserve testing event.
That's great. And you would encourage anyone out at home who's maybe struggling to start that family to give it a try?
Anyone at home or anyone who knows someone who is struggling to please reach out. It'll be on your website as well. And again, it's txfertility.com. Anybody who just has an interest in learning more about the test and fertility testing in general.
It's an emotional journey for families and of friends that I've watched go through it. It's heartbreaking and exciting at the same time.
It can be one of the biggest challenges that we face as adults, particularly for women who have been used to having control of those choices in life.
All right, Dr. Hansard, thanks so much for coming in and sharing more about this test with our viewers. We appreciate your time this morning.
Thank you so much for helping me get the word out.
You bet, you bet.